Hi, I'm Christine. I'm 67 years old. I work full-time, and I'm a pretty active person. Until October of last year, I got into what I thought was a minor car accident, a fender bender, and I started having hip pain, back pain, leg pain, and then severe knee pain that sent me to the emergency room. And for a couple of days I couldn't walk. I had to get a cortisone shot just so I could put some weight on my knee, and I had to get a walker. And I thought, well, I am older, but I really didn't think I'd be using a walker. And I continued to use the walker for several months. I went to see an orthopedic doctor, and she checked me out, said, well, you know, your knee is maybe just arthritic, and she didn't recommend surgery. I asked her if I could have physical therapy, so she prescribed that. I did 6 weeks of physical therapy, but I was still in quite a bit of pain. I had a Baker's cyst, is what the hospital told me, in the back of my knee, and that was painful. So this dragged on for 7 months. The physical therapy did really very little to help me, and I was kind of at wit's end. I had graduated from the walker to a cane, and then I dumped the cane eventually and started just walking around with a limp, but with pain, diminished pain, but still constant pain. So I happened to have an appointment with a nurse practitioner, and she said, you need PRP. And I went, what is that? And she told me, and it sounded great. So I came here to the Sholom clinic, and I met with Dr. Gootzeit, and he said, let's get to the bottom of your problem. And he scheduled an MRI, which I had, and it showed that I had a torn meniscus and some ligament sprains. So he recommended the PRP. And I came in for the injections, and they said there'd be some swelling for a couple of days, and I had very little, and I really had very little pain after the injections. And the next thing you know, I could just walk normally. I had no limp whatsoever. I couldn't actually remember how to walk normally after 7 months, so it took me a day or two. But I feel just amazing. I feel so much better. And I still can't believe how well it worked.
And what is your pain level now in consideration?
I don't have any pain. Once in a while, if I do a lot of extra activity, it'll hurt a little bit. It goes right away.
And are you done with all your
I'm finished.
Post-follow-ups?
I graduated.
Exercises? You graduated? Oh, very good. Christine, thank you so much for sharing your story with us today.
You're welcome.